Hi, I'm Jessica LaFay from Bissell Center. Welcome back for our afternoon. We will be having 3 presentations back to back. So this one here is StreetWorks. We have Matt and Patrick both here with us that are nurses with the StreetWorks team. So Boyle Street Community Services has StreetWorks started in 1989 as Needleworks after 8 city agencies saw the need to address the issues of HIV, hepatitis C, and to be proactive about poor chronic health problems of marginalized populations in the city. StreetWorks provides sterile supplies, equipment, education, and supports to people who use injection drugs and those involved in the city's sex trade industry. Following this presentation, we'll be having Jody from 24/7 Crisis Diversion, as well as the outreach social work team from the library. Also do notice that at the back we are videotaping all these presentations, so they will be available on the Edmonton Public Library website in the next week or so. So if you missed any prior or after this, they'll be available there. And I'll leave it to you guys. Thanks, Matt and Patrick.
Testing. Hello. Hi, everybody. My name is Matt, and this very tall gentleman beside me that makes me feel very short is my colleague, Pat. We're both nurses with the StreetWorks team, and so we're going to go through like a short overview of our programming, a little bit of what we do, and then we'll save a little bit of time at the end for questions, any questions you may have. And we have a little bit of time at the end also for Amy Benson, the inner city paramedic, to come up and speak a little bit about what she does as well. So, to begin, just by show of hands, who has heard of StreetWorks before? There's a lot of familiar faces in the room, so, okay, forgive me if you've heard some of this stuff before, because a lot of what I talk about is a little bit rehearsed when it comes to describing our program and going over the spiel. So StreetWorks is Edmonton's needle exchange program. We provide all the supplies someone might need if they're choosing to inject drugs. So on top of the clean needles, we provide alcohol wipes, sterile waters, tourniquets, cookers, all that sort of stuff. And primarily our goal is to prevent the spread of HIV and Hep C, these sometimes scary sounding bloodborne pathogens. But then ultimately our goal is to keep people as healthy and as safe as possible. Giving needles to individuals can be a very controversial idea because, I'm taking this needle right here, giving it to an individual who will probably take this needle and inject some sort of illegal substance in their body. And how could you justify doing such a thing like that? At a deeper level, the act of giving someone a needle is to try to connect and build relationships with someone who otherwise doesn't have any other relationships. Even amongst people who use drugs, the people who inject are kind of put at the bottom of the totem pole. And you might have heard this in your work, that people will be like, oh, I just drink, I never touch needles, that stuff is disgusting, I will never touch that sort of thing. So even amongst the group of people who do use drugs, those who inject are stigmatized even further and pushed in a corner. So our goal is to reach out to them, build that relationship, and from there work on other things, connecting them to health support, social supports, and all that other stuff. So hopefully we don't have to move the mic too much for my tall friend.
I can talk really loud too. Yeah, so in 1989, 8 agencies got together to kind of address the injection drug and the sex trade issues. So Needleworks was started with 2 outreach workers, and it soon expanded to have 4 staff in a van so that we could do outreach during the day and the nighttime. In 1995, nurses were hired onto the team to look at the broader health aspects of harm reduction, and the name changed to StreetWorks.
A little bit extra on the history of StreetWorks. So originally when the program first started, as Patty mentioned, it was just 2 outreach workers going out. We weren't at a point where we were able to do needle exchange. In fact, what was happening was you had 2 outreach workers handing out bleach kits and match boxes. The bleach to clean the needles people already had as best as they possibly could, and the match boxes to sharpen the needles so they wouldn't become dull and so that people wouldn't further scar and damage their veins. Kind of scary of a thought, but that was the best thing that was possible. Eventually, it moved to a point where we were able to do needle exchange, and how a lot of needle exchanges first started, it was a 1-for-1 needle exchange. This idea that in order for you to get a clean needle, you had to bring one in. The problem with this system, unfortunately, was that people needed far more needles than they could possibly bring in, so you had things where people would, go into hospitals and the biohazard bins, steal used needles to try to get more, which created a new harm, a new danger. So kind of moved to a system we have today where we don't really set a limit on how many needles a person takes. People can come in and take 1,000 at a time, and there's no set demand to say that, oh, you got to bring X back in order to get this much out. people who do take out thousands at a time, they're often grabbing for a large group of people. So we not only serve Edmonton, we have individuals who come from rural Alberta, northern Alberta, that drive into the city, do that couple-hour drive, get 1,000 at a time to provide clean supplies for them and the people that they care about. That being said, because we don't set a limitation on, how many needles come in, the question obviously comes out, how many needles do we get back into our program? So last year we gave out about 1.7 million needles in the entire year, and we got about 90% of that returned back to us. So fairly good return rate. 10% of that large number is still a large number, and so like I said, a lot of that number goes out of our city. It ends up going out. Some, unfortunately, do end up on the streets, and this is something we hate seeing. Our staff hate seeing needles on the street. A lot of our clients, most of our clients hate seeing needles on the street. If you talk to any of our guys and they're like, hey, we saw some needles over there, like, oh, who's that dumbass who left that there? And they get really upset about that. So it's something we all work on. We'll walk around, do city cleanups with our clients, with our staff, and just pick up the needles that we do see.
So people who use injection drugs and or work in the sex trade will have the harm reduction skills, knowledge, resources, and support they need to be safer and healthier. Guided by the social determinants of health and harm reduction principles, StreetWorks will be a leader in the prevention of transmission and the impact of HIV, Hep C, and other bloodborne pathogens, and STIs for people who inject, smoke drugs, sex trade workers, and other marginalized populations.
So the philosophy that kind of guides our practice is this idea of harm reduction. It's a pretty big buzzword. Again, just show of hands, who's heard of it before and the idea? Pretty much everyone, the idea of harm reduction. So the idea in harm reduction, just very basically, there's a very long fleshed out definition above me here, but just very basically, we're there to reduce the harms of potentially risky activities, right? And the key there is on the potential. It's not a guarantee that if you suddenly smoke crystal meth, your life will be ruined, all your health will go way down. It's not a guarantee. There are steps we can put in place to keep you as safe as we possibly can. One of the basic principles in harm reduction is meeting people where they're at in their life. So we meet people across the spectrum, right? We'll meet people on one side of the spectrum where they will come to us and be like, I'm sick and tired of being sick and tired. Give me help. What can I do? And we do everything we possibly can for this individual. So that means, getting them into, helping them navigate the process of getting into detox, which there are only 2 of in our city, getting them into treatment and whatever treatment that means to them, because treatment can look like a lot of different things, and then kind of juggling the timing and the scheduling, how to get someone into treatment and timing the detox times. So that's on one side of the spectrum. On the total opposite side of the spectrum, we meet people who will realistically say things like, I've met a gentleman who said this, I will probably inject till the day I die. I may not die from the injection drug use itself, but I don't see myself quitting. I'm probably just going to continue using. So what do we do for individuals in this part of their life? Well, we meet them where they're at and set meaningful goals with them. So maybe we find out that this gentleman over here is injecting 6 times a day. Part of the reason he injects 6 times a day is because he was never taught how to properly find a vein or how to use needles properly. So we provide him the information, how to use a tourniquet, strategies and tips on how to find a vein. And so maybe he goes from injecting 6 times a day to maybe 3 times a day, or maybe once every other day. And we celebrate those victories. Because unfortunately, one of the failures right now in how we view addiction and treatment and success is that anything less than abstinence is considered a failure. And so we're calling individuals who already beat themselves up on a day-to-day basis for what they do a failure, even though they have a huge step. They went from injecting 6 times a day to now once every other day. Or they went from injecting to now just smoking, which is a huge change, and missing those, those positive changes. So this is a big principle in our work.
So the council that StreetWorks is a part of has multiple members: HIV Edmonton, Boyle Street Services, Boyle McCully Health Center, AHS Edmonton Zone, the Northern Alberta HIV Clinic, AHS Mental Health and Addictions, Catholic Social Services, the EPS, and U of A Addiction Mental Health Lab, and CEASE. So on our team, we have 4 registered nurses, technically, with the HER program. one program manager who is also an RN. We have 2 LPNs right now and two to 3 outreach workers. And then we do have also special project staff. We continuously have interchanging students through nursing, social work, addictions, corrections, and we do get to see a lot of physicians that come through our doors. We do have lots of client volunteers and professional volunteers. And the Alberta Community HIV Fund, approximately about 3/4 of our fund, AHS does the other quarter. We do also have Lottery Fund, Rotary Club. We have lots of donors, research dollars, speaking consultation fees, but those are a little less than.
This is a little bit about our stats. So we have, just over 41,000 visits, 1.75 million needles. I had mentioned that. We have a little bit of we have nursing services. So in our main office in the Boyle Street, we have several satellite sites where we do needle exchange from. But in our main office in the Boyle Street Community Services, we have a little nursing station where people can come visit us. And I always describe our nursing station as a sort of gateway to healthcare, because so many of the clients that we serve in the inner city are missing those basic things of photo ID, of Alberta healthcare. And without those 2 pieces of things, you're very limited on what kind of healthcare you can access. So it leaves a lot of folks leaves a lot of the people we serve as the emergency room being the only form of healthcare they access. And that's no good. That's not a good use of healthcare services. It leads to very negative interactions, and for many reasons on both sides of the parties. So our goal is to provide basic healthcare nursing services very early on and intervening. So we do basic things like dressing changes for folks, wound care related to like abscesses and all that sort of stuff that may happen. Immunizations we do STI testing. And we do a lot of referrals and connecting people to other supports that they can use in the community, and helping them get their healthcare card and all that piece. Here's a little slide on our demographics on the people that we're serving. So the heart of our work is the needle exchange. So this is just a little snapshot of how our needle exchange desk looks in the Boyle Street there. Sometimes for people unfamiliar with the concept of needle exchange, they kind of have this image of a person sitting behind like a glass desk, and there's like a small little hole where a person might slip needles out from underneath. But really, it's a very casual thing. People come in, and it varies the interaction. So we have individuals who, for good reason, don't trust us. In their lives and in their experiences, everything to this point has shown them that they can't really trust the people that say that they're going to help them. So sometimes interactions start out very slowly. There's not much word. We don't talk. They just grab their supplies and go. But over time, seeing a familiar face, seeing that consistent, presence there, people open up and start sharing more and more, and it may go from just talking about the Oilers finally winning for once, or talking about how cold Edmonton is always, to more serious things like there's something in my arm I want you to take a look at, and going from there and connect them to other things. Talk about the van.
So we do have an outreach van. It goes out 7 nights a week from 8:30 to midnight. And we recently just started doing Tuesdays and Thursdays due to the high volume of some of our clients that live on the outskirts of the city. We try to stay inner city every night, but more and more so suburban clients need our services. So we're starting a Tuesday and Thursday 1 to 4 service.
And that's an interesting thing that Patty's highlighting, that when we are on the van, not only do we serve the inner city, we go all over the city. So north side, south side, east side, west side. And it's this whole idea that drug use knows no bounds, right? It doesn't discriminate the color of your skin, how much money you make, where you live. There's tons of people using drugs, and for many, many reasons. I had spoken about this, but this is our nursing station, just a little snapshot. One of our side programs, so the core programming is that needle exchange, then we have little side programs surrounding it. One of them is the Youth to Youth project, and so what that is a youth mentor, so a youth who's sort of been there, done that, and is there to mentor other youth. And the main goal is honest and truthful drug education. The story that I always use to talk about this program is the story of the ad that I saw when I was a kid related to drugs. So this ad you'd see as a kid, when I was a kid, was, this girl coming up holding an egg and telling you that this egg is your brain, putting it on a table, then grabbing a frying pan, and she starts smashing the egg, and she's like, this is what happens to your brain when you're on drugs. And then she starts smashing the rest of her kitchen, breaking dishes left and right. She's like, this is what happens to your family, your education, your life, everything is ruined when you use drugs. I'll give it that there's a small percentage of the population who will see this ad and will be like, oh my God, I will never touch drugs in my life. But then for the vast majority of people, anyone who has drank before they turned 18, smoked a little weed on the weekend before they came to a downtown resource fair, anyone who tried a little E at a party or any other thing, who tried a little something, but then went on to continue with their life, they immediately see ads and campaigns like this and say, that's all a lie. They don't know what they're talking about. So when the time comes that, legit information that is provided, there's just that mistrust with the system that they don't know what they're talking about, they don't know their ads. So the goal of this is to provide honest and truthful drug education, not exaggerated harms, but real harms, and not just don't do it, but if, the message is still don't do it if you can, but if you are going to do it, these are some things you should know to keep you as safe as you possibly can. Talk a little bit?
So part of our sub kind of grouping is the Her Pregnancy Project. They were started about 5 years ago. They're more, part of their mandate is trying to help women who use and may not use, navigate the healthcare system. A lot of the clients avoid healthcare completely and they would just prefer to use and not have anything to do. But if they're pregnant, their most important thing is prenatal care, getting advocacy supports, so that there's 2 RNs and 4 support workers on the HERD project, on the HERD team. And basically their job is to just maintain lines of communication with a lot of these clients, take them to appointments, be their advocates, just make sure that they're getting the best possible care.
Yeah. And so they're battling quite a few things. So one of the things with women who have street involvement and street experience is that there's this fear that my child would be apprehended. And so a lot of women don't want to access any sort of prenatal care because they're afraid that if I access prenatal care, from their experiences in life, looking at their family members themselves, that children are apprehended. So they hide as best as they can from any sort of care. And it's kind of paradoxical because you need to access those services. You need to access those sort of cares. So the pregnancy team is there to help with that connection. Another big part of their work is the harm reduction work in the pregnancy work. So a common question we'll throw out there is, what if someone visibly pregnant comes through our doors and asks for a needle? Do we give this individual a needle? Our answer is absolutely we give her this needle, and it's not just based on weighing the harm of if I told her no, she gets mad at me, turns away, grabs who knows what, a dirty needle and who knows what's in it and uses it anyway. Not just based on those harms, but based on the realistic harms of what is most harmful to mom and baby during a pregnancy. So, for example, hard-sounding drugs like heroin, it's actually more harmful for a mother to stop using heroin altogether abruptly because people are telling her you're bad for what you're doing and shame her into this. So she quits using, puts her body through withdrawal and trauma, and that trauma that she's putting her body through is also putting baby through, so it leads to preterm labor and all these other bad things that happen. So it's much more safer for her to continue using, or perhaps connect her to a doctor so she can get onto methadone or something else like that. So working with those harms and the realistic harms of substance use during pregnancy. One of our other programs is the Overdose Prevention Project. So this is something you might have heard a little bit more in the news as of late related to fentanyl and fentanyl overdoses, take-home naloxone programs. In 2005, actually, StreetWorks was the first program in all of Canada to start a take-home naloxone program. So at the time when the program started, it was like a research project. After the research project ended, it unfortunately lost funding for the program, and so it was an unfunded program. Any extra money we had was put towards buying naloxone kits and distributing a few of them. Now it's a little more widespread. It's available, you hear it in the news, it's available in pharmacies, several walk-in clinics. The idea of the overdose prevention program is obviously to prevent overdoses, and how we do this is we train individuals how to use we provide individuals with overdose prevention training. So that training is not just that life-saving portion where we teach you how to use naloxone, how to inject it, how to recognize an overdose, but it's also glued together with the first part of the training, which is overdose prevention training, which is the practical tips. We equip people with how to prevent overdose from happening in the first place. So these practical harm reduction tips, things like, never use alone. If you're using with someone, take turns when you're using so you can watch each other. Be careful after a break from using. Don't mix drugs. Do a tester. Kind of these sort of things that we try to equip people with.
And the MOTE team is part of Boyle Street. They're part of the mental health unit. They're the the mobile outreach addiction team. So basically, they're the connection that a lot of our clients have to the detox centers. They provide a lot of counseling services. They're basically the client's advocate when they're in their worst position and they want to go for detox and they want to go for intox or treatment. So they're a connection through Boyle Street services.
Sorry, I didn't explain. I didn't have a picture for the MOTE team, so I just threw a McDonald's logo on there. And then the last little program we have, prison outreach. So one of our staff goes out to a few of the prisons once every week or once every other week, providing all this harm reduction knowledge and equipping people with the resource so that, hey, if they're leaving soon, these are some of the supports that you have in the community. This is how you can keep safe. And also letting them know that leaving prison is one of the most dangerous times. This is when your tolerance is low. So being extra cautious and equipping them with those skills. Yeah. So, perfect timing, perfect timing. Before we open up to questions, I'll just take 5 minutes to invite Amy Benson, the inner city paramedic, to come up and talk a little bit about what she does.
Thanks, guys. So my program or project started about 6 months ago, so April 4th. The City Center Paramedic was created to start mostly out of the Boyle Street Co-op because of how the call volume had been noticed. So in January to March of last year, there had been 275 calls to the Boyle Street Co-op, and that takes a lot of emergency resources, and we thought maybe there was something we could do better. So my program was created first and foremost to build relationships within the community, both with staff but also with the clients, to find them the best resources, because oftentimes they were going to the emerge or being called for calls that didn't necessarily need to or weren't being served well at the emergency. They weren't getting the resources they needed. And we figured that if there was somebody in the Boyle Street or in the inner city that was available to answer those questions and maybe do some preventative work or make the decision as to whether this was an emerge call or not, that could maybe free up those emergency resources for true emergencies. So the last 6 months we've been working very closely with Boyle Street and also with Bissell and Hope Mission and any of the agencies we've been trying to make contact with. So if you're from those agencies and you haven't seen me or you don't know what the program is, come by one of the table and we can chat more. But we're a full program now, which is really exciting. So Monday through Friday right now, we're looking to expand our hours in the near future. There hasn't been anything concrete yet. But I'm the person who, if you have a call and you think maybe this needs to be an emergency, maybe this needs to call an ambulance, but you're not quite sure, I'm the person you can call to come down and assess that patient for you. And we can make that decision together as to whether this needs to go to the emergency or whether some community resource could probably be tagged in, whether that be connecting them back to their family physician or sending them to a clinic or getting them the resources right where they're at. Because emergencies in a paramedic's mind are very different than an emergency in a community member's mind. And so we acknowledge that. But it also means that, so when an ambulance shows up, they are legislatively required to transport only to a hospital. And a hospital means long waits typically and often not the right resource, especially with a lot of these addictions and mental health work. So if we can find them the proper resource in the community themselves, then let's do that. let's give them the ideal situation and solution to that problem today, and we'll make sure we do it with a respectful way. And if they do need to go to the emergency, then I can help make that decision. I can call that bus in for you, and I can help give reports so that it's a smooth interaction for the client and for you and for the paramedics themselves. So I think it's been a pretty positive program so far, and I think everybody's seen a real improvement in just the relationships between the community members and paramedics, because we know that that's also been a struggle for a lot of our clientele down here. And so we figured that by putting someone in a uniform who was approachable, we could show that we're human, and that this doesn't have to be an uncomfortable fight all the time. So it just takes a little more understanding of both sides of the story. So thank you for your time. Thanks, guys.
So I guess we're opening it up to questions for the last little bit of time. Yes?
Is there any time frame on the nasal spray for naloxone coming into Canada?
The nasal spray. So it was recently approved. You might have heard in the news that Health Canada gave. So the biggest like hindrance to intranasal naloxone is just the cost of it. It's something like 3 or 4 times the cost of just intramuscular naloxone, and it has like half the shelf life. So I think maybe there may be some certain target populations where it might be more ideal in getting the intranasal version of it, but it's very cost prohibitive at this time. Yeah. Go ahead. Yeah, so there's that change recently that initially when the program was first rolled out, it was only open and eligible to people who did use opioids, to people who were at risk for overdose, but that changed, and so now it's open to family members, loved ones who care about people who are using. And so you can access these kits not only through the needle exchange program, but also community pharmacies, but not all of them do it. So the website that you could use to find all the walk-in clinics and pharmacies that do it is www.stopods.ca, so stopods.ca. You'll jump to an AHS website, and you can click on the links to find the list of all the pharmacies that are doing it. And then just a side note that not all pharmacies are created equal in their training and how they're equipping people, but you can still get a kit and get your hands on that if you're interested. Yeah?
Do you know how much it costs?
Each kit? It's totally free if you go into the pharmacy and get it. Yeah, so no cost, but the cost to put it together is something like 33 around there, 33, 35 each kit. Yeah. All right, cool. Thank you for your time.